Hi, my name is Florence Ajayi Barnes, your virtual family nurse practitioner, and welcome to the Flo-Medical Show, where you get information and advice you can trust. On the show, we discuss health, being an educated consumer, and you being your own best advocate. Disclaimer: this is valuable information, but please consult your healthcare provider. Today's discussion will be on arthritis. Arthritis is the inflammation, stiffness, and pain of the joint. It occurs gradually and can get worsened over time with age. Arthritis has a profound economic, personal, and societal impact. Arthritis affects 1 in 4 adults in the United States. That is approximately 5.8 million adults in the United States. It is the leading cause of work-related disabilities. It also accounts for over $160 billion in lost wages to employees. These numbers are steadily rising. What are the symptoms of arthritis? It is inflammation and swelling of the joint, stiffness, tenderness, redness, decreased range of motion, decreased mobility of the joint. There are 4 different types of arthritis. You have osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and infectious arthritis. Osteoarthritis. Osteo, meaning bone. Arthritis, inflammation of the joint. So you have inflammation of the joint concerning the bone. This is when the flexible protective tissue that is at the end of the bone, which we call cartilage, begins to wear down gradually, and over time it gets worse. Then you have rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease. That means your immune system is attacking the body. And in this case, the immune system is attacking the joint. You have psoriatic arthritis. Psoriatic arthritis is linked to a disease called psoriasis. This is when you have dry, patchy, red, scaly patches on the skin that also has indents in your nail beds. So this is an arthritis that is linked to a skin condition. And lastly, you have infectious arthritis. That is when an infection is causing you to have inflammation in your joints. This infection can be either a bacteria, a virus, or a fungus. And usually it occurs in other areas of the body and now is affecting the joint. How do you know you have arthritis? Usually if you have joint pain and stiffness for 6 weeks or more. If you have morning stiffness for 30 minutes or more. And it usually occurs in more than one joint. And usually it's the smaller joints, the joints of your wrist, your hands, and your feet. Treatment. There are many treatment options for arthritis. And with all treatments, we always go from minimal treatment to the maximum treatment. The first treatment option is rest. Maybe you've used that joint repeatedly and you've overused it and it just needs some rest. If rest doesn't help with the situation, You can always put hot or cold compress. You can get some hot packs, cold packs, hot towel, warm towel, cool towel, and apply it to the joint. This usually helps to decrease the inflammation and pain at the joint. If in event that that's not effective, your healthcare provider can recommend you have or you start medications. The most common medication that we use are non-steroidal anti-inflammatory drugs, which is abbreviated as NSAIDs. NSAIDs, just what they are, non-steroidal. They have no steroids in them. And they're anti-inflammatory, which is they have properties in them to decrease inflammation in the joint. And those medications are ibuprofen, Motrin, Aleve, Advil, Naproxen. So those are the common ones that we use when treating arthritis. If you cannot tolerate taking the NSAIDs, you could always take Tylenol or extra strength Tylenol to help you with your pain. If these do not help you, sometimes we can recommend that you get a steroid injection or take steroid pills. Steroids are usually given in short period of time so that we can decrease the inflammation in the joints. And then if those don't work, the recommendation can be to start the patient on a narcotic, which is a highly addictive pain medication given at a short period of time just to decrease some of the pain the patient is having. Most of these treatments can be used in combination with one another. If oral medication, which is medication by mouth, is not helpful, or the injection of steroids are not helpful, it is recommended that you get some form of physical therapy or occupational therapy. That is when we're moving the joints in the full range of motion, exercising the joints, and strengthening the muscles. Because sometimes when we put these joints through further range of motion, this will help the inflammatory process. If you use all of these treatments in combination with one another and you still are not getting effective relief and you're still having a lot of pain, the recommendation is to have surgery. Most often when people hear surgery, they are scared and instantly are not interested in having it. But my experience have been if the patient is informed and educated about what is the prognosis of their care, they're more likely to have the surgery so they can have reduced symptoms. Also, surgery will increase your quality of life. You want to be able to do more with limited or less pain. How can you decrease your risk of developing arthritis? Maintaining a healthy weight. Excess body fat and excess weight will cause more stress and pressure on your weight-bearing joints. And your weight-bearing joints are your knee and your hip joints. So you want to maintain a healthy weight so you don't increase your risk of getting arthritis. Maintaining a normal blood sugar. Over time, if your blood sugars are not controlled, it can lead to deficits in your muscles and your bones, and it also can lead to nerve damage. And this will cause your increased risk of arthritis. According to the Arthritis Foundation, diabetics are twice as likely to develop arthritis than non-diabetics. So controlling the sugar will put you at a decreased risk. Exercising. Exercising regularly will exercise and strengthen the joints, putting it through a full range of motion, allowing the joints and muscles to be healthy. Also stretching. Sometimes we don't use certain body parts routinely, so you want to make sure that you stretch before you exert any efforts on those joints. Don't get any injury to your joints. If you can avoid injury to the joints, that will also help. Because if you get injury to a joint, it causes the joint to be stiff and then causes inflammation. Quitting smoking. Most smokers have a high inflammatory protein in the body. These are called cytokinase. These inflammatory proteins are increased through smoking, which is then going to increase the inflammation process in your joints. Eating a healthy diet, making sure that your diets are filled with vegetables and fruits and not refined sugars. So you want to make sure you eat healthy foods. You can also take supplements. Supplements like turmeric. Turmeric is a common Indian spice that has anti-inflammatory processes. You also have omega-3 that has anti-inflammatory process in them. You have Bioflex, which is a supplement for bone and joint health. Eating fish and shellfish at least twice a week because these foods have high anti-inflammatories inside them. They have high anti-inflammatory properties that will decrease the inflammation in the body. And these fish are salmon, tuna, mussels, snow crabs, oysters, clams. These are foods that are high in anti-inflammatories and that will help to decrease inflammation in the body. So, what are foods that you should stay away from if you have arthritis? Pastries. Sugars are one of the number one things that are inflammatory in the body. So avoid the pastries and the sugars in the body. Also, pre-packaged meals. Pre-packaged meals usually have preservatives and they have inflammatory processes in them. So you want to avoid pre-packaged meals. Red meats. Red meats you should avoid. Fried foods avoid. White breads, white rice, all of those refined carbohydrates should be avoided. You should pastries, breakfast cereals, they have a lot of sugars in them, pastas, pizza dough, all of these things should be limited in your diet because they have an increased risk of inflammatory process. There you have it. Now you have the information you need, know what to look out for, and treatment options. Please remember to like, subscribe, and share this information with anyone you feel can benefit from it. My name is Florence Ajayi Barnes, your virtual family nurse practitioner, and thank you for joining us on the Flo-Medical Show. See you next time.